Hello, let's learn about hand hygiene. Studies by Ignace Semmelweis in Vienna, Australia, and Wendell in USA established that hospital-acquired diseases were transmitted by hands of healthcare workers. Semmelweis was opened a house officer in one of the studies and he noted that doctors and medical students often went directly to delivery site uh, and had a describable odor on their hands. He reported that cadaveric particles were transmitted by hands. So as a consequence, he recommended that hands be scrubbed with chlorinated lime solution. And after this practice, the mortality rate declined from 3% to directly to 3% in the clinic, and it remained affected and remained low thereafter. Even in 1938, Priest established that the resident flora of the hands consist of microorganisms residing under the superficial cells. Staph epidermis is the commonest of the organism. Among fungi is the Pterosaurus species. Resident flora has two main functions and microbial antagonism and competition for nutrients. So resident flora is less likely to be associated with infection but may cause infections in sterile body cavities, eyes, or in opportunity circumstances or non-intact skin. Hand washing with soap and water has been considered as a measure of personal hygiene for centuries and has been generally embedded in religious and cultural habits. Nevertheless, the link between hand washing and the spread of disease was established only 2 centuries ago, although this can be considered as relatively early with respect to discoveries of Pasteur and Lister that occurred decades later. What's the problem? 1 in 10 patients get an infection while receiving care. Up to 30% of the surgical patients get a post-op infection. 90% of the healthcare workers do not clean their hands. Infection causes up to 56% of deaths. Up to 20% of the African women get wound infection after cesarean section. 50% of the injections given in some developing countries are unsafe. Infection can lead to antibiotic resistance. Now, what's the solution? Have an effective infection control program, target antibiotic resistance, use clean practices, follow hand hygiene, have enough staff, monitor the infections, never reuse and use the antibiotics only when truly needed. Healthcare without avoidable infection prevention control contributes to achieving sustainable development goals and could save millions of. So when the evidence of infection prevention control epidemics could be seen from this slide, wherein it was observed that more than 30% reduction was observed by effective IPC programs. 25% to 50% reduction was brought reduction in hospital acquired infection by surveillance. 50% reduction was observed in reduction of pathogen transmission by improved hand hygiene. Nearly 13 to 50% of the so infections, especially surgical site infections and MRSA impact were reduced by effective IPC programs. MRSA declined by 50% by IPC program. So there are many such studies who have concluded that is the single most effective measure in reducing healthcare associated infections. The task forces on hand hygiene in healthcare focuses on behavioral changes, education, WHO recommended antiseptic formulations, glow use, water quality, patient involvement, indicators for implementation monitoring, regulation, advocacy, guidelines on hand hygiene. The global burden on healthcare associated infections, the transmission of pathogens, strategy to prevent the transmission of pathogens, and indication for hand hygiene, it can be referred to the WHO guidelines. Now, what happens in a healthcare setting? The first step is the patient surroundings, the patient hands get contaminated with his own flora and with the environment, and then this germs present get transferred to the healthcare workers' hand in the step two. Step three, the germs survive if not proper hand hygiene done or decontamination disinfection done. And the fourth step, then they remain contaminated and they multiply. And the fifth step, they then contaminate the hands of the healthcare workers and it then passes from health to the patients and vice versa, and the cycle continues. Uh, Improper hand hygiene or improper environmental cleaning can lead to the transmission of pathogens. Now, why we should do hand hygiene? Any healthcare workers needs to be concerned about hand hygiene because it protects the patient as well as protects your. Hand rubbing is the preferred method if the hands are not visibly soiled. If soiled, then hand washing. To reduce how to hand rub to effectively reduce the growth of germs on hands. Hand rubbing should take place at least for 20 to 30 seconds. First as you can see from the picture, first is palms to palms, when palms to the dorsum and vice versa, then the palms to the finger interlace, then the then rotational rubbing of the thumbs into the opposite palms, then the clenched fingers into the opposite palms, then the clasped fingers into the opposite palms, and vice versa. And this is how this is, and finally the wrist. So these are the 6 steps of hand hygiene. For if it's do hand washing, then it should take at least 40 to 60 seconds. It's preferably recommended for clostridium difficile infections and for contact with. Now, tips before starting the surgical hand preparation, it differs. Do not wear artificial nails. Keep the nails short. Remove all the jewelry. Hands should not have any watch angles, bangles, threads. It's a prerequisite for hand hygiene. Clean subangle areas with nail files. Nail brushes should not be used as they damage the skin. Start scrubbing. Scrub each side of the finger, between the fingers, and back and forth as per the six steps. Then proceed to scrub the arms. Watch each side of the arm from wrist to the elbow. Wrist to the duration from the wrist to the elbow for 1 minute. Repeat the process on the other hand for another 1 minute. Rinse hands and arm by passing them through the water in one direction only. That's from the tips of the fingers to the elbow. Do not move the arm back and forth and through the water. Proceed to the operation theater, holding the hands above the elbows. At all times, care should be taken not to splash water onto the surgical attire. Once in the room, hands and arms should be dried using a sterile towel and aseptic. So this 6 steps of hand hygiene should be followed at all the 5 moments of hand hygiene, which include before touching a patient, before any procedure, after touching a patient, after any procedure, and after touching a patient's surroundings. This is done to prevent the germs from entering the of one germ resident flora entering the own sterile body cells from the healthcare workers and from patient to patient transmission and patient to healthcare transmission vice versa. The use of gloves does not replace the hand hygiene, so hand hygiene should be the priority. Gloves should be limited. WG recommends alcohol-based hand rub based on factors such as evidence-based intrinsic advantages of hand rub based on bactericidal activity, suitability for research limit settings, and capacity to promote improved compliance. Then, what are the examples of common water contaminants? It are the inorganic salts, organic matter, biocides, microorganisms, and dissolved gases. The concerns are because of the contaminants inhibit the activities of the antiseptics, toxic chlorine disinfection byproducts takes place for leads to biofilm formation, cause corrosion, rusting of equipments, and others. So alcohol should be used at a concentration of 60 to 70% for an antiseptic. It's faster in action, leaves no residual activity. But chlorizanol has it should be used on up to 4%. It is slow speed of action and contradictory because of the residual activity. The comparison of the alcohols and other antiseptics from gram-positive, gram-negative viruses, mycobacterial fungi, and alcohol is observed as one of the most effective antiseptics as compared to other chlorizine and others.